careers in public health. So we have our leading expert in this webinar. We have Dr. S.D. Gupta ji, who is the chairman of IIHMR University and a leading public health expert. Um, he is PhD from the Johns Hopkins and has been guiding many research, and also currently he is advising the government of Rajasthan on combating our response to the COVID. Then we have Dr. D.K. Mangal. He is Dean Research with IIHMR University, and again he has a very illustrious career in public health with many publications to his credit. So both these experts from the IIHMR University will be speaking to you about the career options and the different dimensions of career in public health. As you know that IIHMR University was established, our IIHMR was established 35 years back, and then the university right from its inception has been the top institution in the area of healthcare management. We have been running programs, postgraduate programs in hospital and health management, pharmaceutical management, rural management, and also our flagship program of Master in Public Health. So Master in Public Health program has been designed exclusively with Johns Hopkins University. We have very long-standing relation with Johns Hopkins University for over 35 years. Our founder trustee is a trustee with the Johns Hopkins, and also our chairman, the advisory board, and many of our faculty members are also adjunct professors with the Johns Hopkins. So this collaborative program has been designed with the Johns Hopkins University, where the part of the program is conducted here in Jaipur, and certain courses are taught by those professors who are also adjunct professors with both university and the Johns Hopkins, and certain courses are taught by the faculty from Johns Hopkins through the online mode. And students also are having an opportunity to go for the winter school to attend several courses in Johns Hopkins. And then you get a post-certified degree certified by both Johns Hopkins and the IIHMR University, and you have the freedom whether you want to take commencement here in Jaipur or in Bhatti. As you know that this COVID and this whole pandemic has given us many challenges and also a lot of opportunities for career in the public health. And public health is a career where you can make a big impact, not only in terms of making a transformation, saving so many lives, and also making a big difference. So generally people are being governed more by the career prospect, money, the placement salary. That all is already there. Our students who have graduated from our program, they are working in NITI, World Bank, WHO, and many premier organizations. And also some of them have also started their own companies. Some are working with companies like QEF, working with Ayushman Bharat, and making a big difference. IIHMR Jaipur itself has about 4,000 plus alumnus. And if you go to any healthcare institution, hospital, or any research institution, you will see that our students are there in a leading role. So, and one more thing which I want to share, that our whole curriculum and whole focus is very, very research based. You'll be happy to know that there are many important research projects such as PMA 2020, PMA Agile, GAIN, food fortification projects. Bill and Melinda Gates Foundation has given us projects. WHO has given projects. So, and also the NFHS we have done in 5 states. So our faculty is not only teaching something just from the book or theoretical knowledge, but it is coming from their hardcore research and that is a very unique experience. And you also get an opportunity to work on many live projects and research assignments. So this is in short, I wanted to share about the IIHMR University and our unique feature. And while you are here, you will also have an experience of a great campus life. We have got a very beautiful campus, and we also have different centers, different interest groups, and also we have a center for mindfulness wellness, and where if you want to explore different things in Dan, Gyan, and Dhyan, want to try meditation, pranayam, want to try mindfulness, and to know how, what is the seed of possibility you carry within, and how to nurture and take your career, not only the career but the whole life goal. So that is what I just thought to share with you. Now I'd like to um, request Dr. S.D. Gupta ji to share his thoughts.
Mangal.
Okay. So Mangal ji, would you like to share?
And my greetings from Pink City, Jaipur, and IIHMR University to all the prospective students who are considering this MPH program as one of the career options. I'll just like to reiterate what Pankaj ji has mentioned, that it is one of the best program in public health offered in collaboration with the topmost university in the world in public health, that is John Hopkins University, the School of Public Health, Bloomberg School of Public Health, and IIHMR University in this part of the world. This program prepares the students for performing the role of a public health professional. And during this webinar, we will elaborate on that what are the opportunities these professionals have, and what roles they play in helping people, communities, countries, improving the health of people. Now, as you are all aware, today the entire world is facing the pandemic of a new viral disease, which is called as SARS coronavirus 2, and in brief it is called COVID-19 because of the year when this disease appeared first. Now, everybody, all countries with no exceptions, are using the containment measures to safeguard the life of their people. These are the type of opportunities where the public health competencies are required, and therefore this example is very apt example to emphasize on what this course will offer you, what this course will prepare you for, and the opportunities are immense, and we are going to talk about those opportunities in a short while. So I think I'll stop here and then hand over to you for further elaboration on what the students can expect after they undergo this program, and what are the different opportunities that they can look for.
Well, thank you, Dr. Mangal. Thank you, Dr. Pankaj Gupta, for giving this introduction of IIHMR University, and also about the current situation we are going through. I'd like to welcome all the participants in this webinar. It's very important times for public health globally, and this is a big challenge for public health today. To contain the pandemic, reduce deaths as early as possible in a very effective way. And more than half the population of the world is under lockdown. It was necessary because there is no treatment for COVID-19 and there is no vaccine. Only thing is, only thing with us is only to prevent spread and protect ourselves. And that's why this lockdown. So key thing so as of today, there are 2.7 million cases that have occurred worldwide, US being the most affected country, and some European countries like Italy, Spain, France, UK, Germany, they are the countries which are most affected. The virus started from Wuhan to Italy to US, and in India it came directly from Wuhan. Medical students who were studying there in Wuhan came to India, and this is how first case in Kerala started. So globally, what we see, close to 190 lakhs, 1.9 lakhs cases or deaths have occurred, and in India about 700 deaths have occurred. As of now, 23,000 cases have been reported, Maharashtra being the most affected state. Next to follow is Gujarat, Madhya Pradesh, Rajasthan, and Chennai. These are some of the worst affected states. Anyway, so what is very important today is what public health measures we can take to contain this spread of dreaded disease, which has killed about 2 lakh people around the world, and we really do not know how long this pandemic will continue. But the answer to this is public health measures. Anyway, somehow this is just a coincidence that we are talking about public health courses. So IIHMR University, can we have the slides? Hiten? Hiten?
Yes, sir, I'm doing.
So we shall be talking about the Master of Public Health program, and this is a very unique program of the Johns Hopkins University, ranked #1 in the world. Is ranked #1 in the world, and it is for the first time. It's for the first time that Johns Hopkins University is offering any program anywhere in the world outside the United States. So this program is offered at the IIHMR University. Next, please. The overarching goal of the MPH program is to provide students with population perspective on health. Hopkins IIHMR Cooperative MPH program is designed to prepare students or future health professionals to tackle current and emerging global public health challenges like pandemics, HIV/AIDS, obesity, diabetes, CVDs, cancers, disparities and inequities in health systems, and many other public health problems that directly affect the health of the people as well as economy and development of the countries. Now, as I said in the beginning, and Dr. Mangal and Dr. Pankaj Gupta also referred to, we are currently in the grip of a pandemic of COVID-19. So the answer lies where? It is the answer lies in public health measures. So this program, this MPH program, will be useful for in becoming a efficient and effective public health professional. And the degree given by the Johns Hopkins University, this is something we need to notice, that the degree is given by the Johns Hopkins University, and the course is taught in India. Almost 60% is taught in India and 40% by the Johns Hopkins faculty. When the convocation is there, so you can go to convocation in Baltimore at Johns Hopkins University, get your degree, or the degree can be sent and given to you in the convocation of the IIHMR University, which follows Hopkins convocation. Now, who are eligible for this program? Now, it's a wide range of qualifications at the graduate level. They could be medical graduates. These could be BDS graduates. There can be graduates from microbiology or biotechnology or science, commerce, economics, computer science, information technology, and other health related disciplines. You need to have good academic records. So the eligibility will begin with your graduate degree, at least 55% of marks in graduate levels, and then 2 years work experience is required, working in any health setting. It could be hospital, or could be in NGOs, it could be in public health or wherever, but delivering care, or in the research organizations if you have worked. Now, each student who aspires to get admission in this Johns Hopkins MPH program, they have to clear TOEFL and also GRE. So those who are interested should go for TOEFL immediately and also take GRE. Both can be taken online. But the medical graduates are exempted from TOEFL and GRE. Maybe BDS be also exempted from TOEFL and GRE. The admission process is like this, that you can go to the IIHMR University website. You will find MPH, click it, and you will see a link. If you link it, then you will find the first screen. First screen is a one-page questionnaire. You have to complete it, fill it up, and send it back to us on the given email ID. If the review committee at IIHMR University finds you eligible for going for admission in the MPH program, then they will inform you, and they will also inform the Johns Hopkins University. Your papers will go to Hopkins University, and you will get a request letter for completing application form. They will send you a link on which you can start submitting or completing your application and submit. The very important thing, which is time consuming, and we should really, those who are seriously interested, since this is a Hopkins program, so all admission criteria are those of the admissions at the School of Public Health, Johns Hopkins University. And it requires credentialing of documents. Credentialing the degree that you have, so they try to do equivalence of the degree that, or the qualifications that you have with that of the American degree. With other global programs on the in the area in which you qualify. So they do credentialing, and then you have to also take the transcripts from your university or your colleges, which need to be submitted to. There is you can find out from our website. You have to send your documents to World Credentialing Service. You can find it out on our website where to send it. Once the application is complete, they will start the review process, send it to Johns Hopkins. There is a joint admission committee. 2 faculty members from Johns Hopkins and 2 from IIHMR University. And once your application is approved for admission, then you will be conveyed the results of admission about acceptance or rejection. But very important thing here, now go back to the previous one. Very important is what we have noticed is the delay in credentialing and transcripts. So you should start preparing for it. The credentialing of the documents, you can start it, and also obtain transcripts of your degree and also your mark sheets, your certificates from your college and university, and then that becomes a major hurdle in admission. So start with it, complete the first screen questionnaire on our website, submit it, and based on that, we will inform you that you are eligible for admission in this program. Next, please. The fee structure is $22,000 in 2 tranches, out of which 12,000 is to be sent to the Johns Hopkins University directly, and $10,000 to be sent to IIHMR University. So this fees includes 2 years instructions, all courseworks, and also within this, the travel expenses. That means your air ticket, your tuition at Hopkins, travel and stay in Baltimore to attend winter attire is borne by IIHMR University from the amount which you give to IIHMR University. So there is no additional thing which is required for travel to US and stay over there, and you don't have to pay any tuition over there. So it includes everything. And then, but at IIHMR, when you attend courses here, you have to pay separate hostel fee. You can find out from our website what is the current hostel fee, and there's a very good hostel, most modern high-tech hostels, air conditioned, and the campus is beautiful. You will have a feel of a resort on which you stay. Next, please. What are the competencies that we address? Epidemiology and biostatistics. These are the core competencies which are addressed over there. So you have to develop epidemiology and biostatistics are the backbone of public health. And then environmental health sciences competencies. You all know about environment influences health of the people, how to do risk assessment, characterization of risk, identify risk, and do mitigation. You find that a lot of natural disasters do take place. We are through a natural disaster pandemic. COVID pandemic is also a kind of natural disasters. So competencies to deal with such situations, and then core competencies and concepts in public health biology. Very important in this program this is how this makes this program unique as compared to the programs in United States and globally, and also in India. That it is almost 40% of the courses are related to management competencies. They include planning of healthcare, they include planning and management, core areas of management, behavioral sciences, they include logistics and supply, various management of information systems, and likewise. So these are some of the management areas which are covered in the program. And then social and behavioral sciences, especially like health economics and finance and communication, this behavior change communication especially. Very importantly, we talk about health policy, evidence-based health policies, and ethics competencies. So these are the 6 core areas of competencies which are covered. Last year, we added new competencies about, negotiating skills, about so you are taught the principles of management, basic demography and population sciences, statistical reasoning, health systems and low and middle countries, problem solving in public health, and then negotiation and mediation, event activities. Then you do goal analysis. Then some new issues that have been added, programs have been added, building collaborations across sectors to improve health. And then 2 more, this is social determinants of health and systems thinking. So, and then principles of negotiation. So these are some of the new small courses of few hours have been added to the core courses focused on the core competencies. Now, what you see, this program structure is a 2-year full-time program. Hopkins directly offers online MPH program also. This program is certified by CEPH. This is the credentialing agency of United States, which credential the public health education in United States. So the program is for 2 years. It's a full time and it covers 82 credits. In the first year, so we follow the quarterly terms, and there are 5 terms in the first year, and wherein we offer 14 courses plus those 5 small courses like in negotiation, collaboration, all those. So this all is done in the first year. So you can see 19 courses in 12 months time. It's really rigorous. So one thing is this, that you have to be mentally prepared to go through this rigor of working. And the timings may be US timings or maybe Indian timings, depending on the courses which are taught. So theoretically, these are 2 years, but practically this is 1.5 years or so. So second year, as soon as you finish your courses, the coursework, complete them successfully, you pass in all courses, then you move to second year, that is practical. So you choose a topic on which you work with the assigned advisor, and it depends. So you go and develop a proposal, go and collect data and write a sort of a dissertation or a practicum paper. and submit it. As soon as you submit, so the last date of submitting the practicum to qualify for convocation in May of the second year, May of the second year, you have to submit your practicum. You can go to your own workplace, or you can find out another place of your interest or agency where you want to work, or IIHMR University placement facilitators can help you to identify a place. Our students, next please. So effectively, you can we go further? Next slide. So what we do is, these are the common, what is the, you might want to ask what you are going to get out of it. We are undergoing through the cohort 7 of the students, and the new students will constitute cohort 8. And the course will begin in October. Maybe the first Monday of October, the course will begin. So we'll inaugurate the program in first week of October. So up to next October, you finish your courses. Thereafter you are eligible for practicum, and then if you finish it early, you are eligible early for award of the degree. What are the career opportunities and what you can be? Might have heard Dr. Pankaj Gupta, the Vice Chancellor of the university. We are really very proud that our alumni, over 3,500, are spread all over the world and India. If you happen to go to the Ministry of Health, Government of India, or Ayushman Bharat, or Niti Aayog, or WHO, or UN, or Price Waterhouse, KPMG, or you will go to state governments, their health department, you will see alumni of IIHMR working over there. So up till now, what we have seen is a great potential for being placed in very nice situation and great institutions of your choice. So you have the opportunities to become health administrators once you get MPH. Then you can be program managers. You can be consultants in specific public health programs. So disaster management and information system, NGOs, and another emerging area is research. Research in health systems, research in policy, research in program management, and core research areas of public health, where you can get engaged. And then consultancy, where you can set up your own consulting startups. You can start your own, or you can work with any level of consulting in India and outside India, or in the US or Europe and anywhere, because this is an internationally recognized degree. So you have once you have this degree, you are in the network of Johns Hopkins, which is everywhere. You go in any part of the world, you will find Johns Hopkins graduates. So that is an added advantage. So there are many things that you can do depending on your interest areas. And as I said in the beginning, who can defeat Corona? Who can provide leadership? And the only way to deal with the Corona pandemic is prevention of the spread and containment of the infection by testing, isolation of the cases, treat them with whatever you have, and then trace the contacts, test them, and containment measures in the containment areas. And then you had also, so there's a huge scope so most of Dr. As you might have heard, Dr. Mangal or Dr. Pankaj Gupta, that I'm from public health, so I'm so honored with getting the opportunity to advise the government of Rajasthan as member of the advisory group on COVID-19 prevention and control in the state of Rajasthan. And I'm also a member, I've been appointed member of task force for lockdown strategy, exit. So I can understand how public health is playing important role in prevention and spread of a disaster like pandemic of COVID. So huge opportunity for working in this global arena of public health. Can we go to the next? Can we move next? So what are the other things that, oh yeah, please go back. Go back. Oh yeah. Epidemiologist. These days, this creature is most wanted everywhere because they are the public health professionals who specialize in epidemiology. And then we are very much in need of people who can handle data, analyze data. So your role in so this public health MPH helps you. You can emerge as a data science expert in public health, research specialist, and you can move on to a doctorate degree, PhD, and maybe Dr. Pankaj Gupta may soon announce Doctor of Public Health soon at IIHMR University. You can go for it, or at Hopkins you can apply for Doctor of Public Health. And then this climate change and its impact on health provides you another window to specialize on. And then you all know about the situation in nutritional health. We are, India is typically, I don't know whether what we should say, but more than half the malnourished children in the world come from India. And there are a lot of things which are needed. Anemia is a huge problem, so area of another important area. Then behavior change is very important. We are asking people to remain in home, confine themselves in home during lockdown, and they are not. They're trying to come out. So for last 1 month, we are saying stay in home, but people come out. You might have also seen on television people fighting with police. So what is happening around? Why this behavior, or why people are, attacking medical teams or police? So this, what is this behavior? And so this behavior change is very important to bring change in health. So, and then some of the areas like health economics and finance are very important to measure the cost of care, cost benefit. These are some of the things which are so necessary. What GDP you spend, and then finance management, which is very critical for resource mobilization in health programs and budgeting. Okay, so these are some of the very special areas where you can enter in with this degree. As you move in, you have to continuously upscale your skills and knowledge, of course. That getting MPH degree from Johns Hopkins IIHMR does not say you will be on the top unless you do hard work and commit yourself to your job and build your skills and competencies over and above what you learn in the classroom. So ample opportunities. Those graduates who have graduated from MPH till so far are in positions with WHO, UN, with the government of, and then many of them have proceeded with to work in Europe, UK, and US. And likewise, this degree definitely enables you to look at the global perspective in your career. So think about it. Next, please. Who are the employers? You will see research institutions, knowledge process firms, funding agencies, hospitals, private sector, government sector, and teaching institutions and universities, consulting agencies like PwC, KPMG. There are so many. We know only these big four, but there are so many, and there are so many foundations which are working for in the health sector. So these are the potential employers in India and outside India. That opens an international arena for you and opportunities. Next, please. If you want to go for one more information, you can ask your questions. And if we have time, we will definitely respond to your question. So you can see the link to know more about this MPH program. It is never before, after, or you can say after, say, 50 years, this opportunity, though blessing in disguise, that this corona has opened new vistas for public health professionals. And I believe you will succeed if you try it out. So next, next. Okay, thank you so much for patient listening. You can send your questions. I believe you have already many questions. I, Dr. Mangal, and Dr. Pankaj Gupta, Vice Chancellor of the University, will be very happy to respond. Dr. Mangal is Dean Research at IIHMR University. They will be happy to respond, and of course, I am available to answer your questions if they pass those questions to me. Thank you so much. Thank you, Dr. Pankaj Gupta. Thank you, Dr. Mangal. And thank you, everybody.
Okay. पंकज बोला मंगल नहीं बोला क्वेश्चन आ गई क्या क्वेश्चन आ गए
Dr. Mangal, can you read these questions? Mangal sahab, can you hear me? Dr. Mangal?
हितेन जी ये रीडेबल लगी है स्क्रीन इसको
ये बहुत छोटे छोटे क्वेश्चन है भाई
Okay.
और थोड़ा फॉन्ट साइज बड़ा कर लो When I come closer.
It's okay, Mangal sahab. Let's go.
First question is, please start fast. People have to work in evening at home due to lockdown of COVID-19. So humble request to start as soon as possible. I think this is about the starting of the webinar. The next is not able to. Please send seminar title. Hello, sir. Happy to participate in this session. Could you please share job opportunities for fresh biostatistician? Now, These are not very specific questions related to this program, but if one-to-one you want to seek help, then we will be able to share more information with you. Next question is, sir, I'm a BBA graduate, but I am interested in this course. So does my graduation background will affect my placement? Okay, so as sir has very nicely explained what are the requirements for admission, and he has specified that the graduation with 55% marks.
Mangal
in,
Sahab, I mixed management in that. The eligibility qualifications, management is also there.
yeah, so it is there. That's what I'm
Please
explaining.
add.
But he or she has to take GRE and TOEFL, and then can apply for this course. And once you do MPH program, then you will be in a different league. So your BBA will not be a hurdle in any way in your future career. Next question is, this is not a question. This is just a message that our old alumni is very happy to see both of us on the screen. So thank you very much. Another question is, he is based in Ethiopia, Africa, leading network of 21 hospitals. Dr. Manoj, he must be our alumni. So nice to learn about it, Ashok. And we are so proud of our alumni who are working in parts of the country and different parts of the world. And they're doing great. Next is why. Okay. Next is, I'm interested to hear distance learning courses which can further enhance my public health management leadership skills and career growth. Manoj, thank you very much for your interest. And currently, we are not offering any distance learning course, but we are in the process of designing several courses which will be offered online on public health competencies and leadership skills. And at that point of time, you will find the information on these courses on our website. And also, we will remember you and will share such opportunities with you. Hitendra, can we take next question? Yeah, okay. Could you please make us understand about future of MPH graduates in India and of and other LMIC countries? Neha Agrawal. Neha, I think Dr. Gupta has very elaborately explained the opportunities that MPH graduates have, because it's a degree offered in collaboration with one of the best universities in the world, the topmost in the rank. So there are immense opportunities for MPH graduates, both in India as well as in other countries. Even the students who are undergoing this course, they are eligible for OPT option that is available for the students who undertake master's program in US. So this is specifically, if you want to know about what are the opportunities in India, sir has already explained, but I would like to tell you that India is a big country. There are more than 700 districts and more than 2,500 blocks, from block level to district and subdivision, and then state level and national level. There are several opportunities at all these levels for public health professionals. So there is no dearth of opportunities, and especially currently this epidemic has re-emphasized on the importance of having public health professionals in the team at every level, and therefore I'm confident that more opportunities will be job opportunities will be there for MPH graduates in India as well as in abroad. Next question is, sir, is there going to be a discussion only on MPH program? Any discussion regarding the career opportunities for health and hospital administration? Okay, that's our another flagship program, friend. We offer MBA, full-time 2-year MBA program in health and hospital, and that program is also doing so well that our graduates are almost everywhere. You go to any part of the country, any big hospital or any government setup of NHM or any NGO or bilateral agency, you will find alumni from IIHMR University. And therefore, there are a lot of opportunities for MBA graduates both in hospital as well as in the health sector. Next is, sir, what about homeopathic graduates? Manoj. Yeah, so the students with graduate degree in homeopathy or BHMS, they are also eligible for applying for this program. Sir, if you can correct me if this is,
Yes, graduates in homeopathic, BHMS,
Ji.
the BAMS in Ayurveda, they are also eligible for admission.
Ji,
Now,
ji,
the
sir.
students
Do
are
they
they
have to?
from GRE? No, they are not exempted from GRE and TOEFL.
Yeah, that's what. So they are not exempt from GRE and TOEFL, but they are eligible for admission in the program. And the criteria of the experience is also necessary prerequisite. Next question is, sir, why BAMS graduate are not exempted from GRE? Sir, over to you. I'll not be able to explain this.
It's a policy decision of Hopkins. So because particularly these Ayurveda courses are taught in Hindi and likewise, English proficiency is must to go through this MPH program. So therefore, they are not exempted from GRE and TOEFL.
Yeah, thank you, sir. So it is a policy of John Hopkins University for the admission in their very prestigious course. Okay, next question is, sir, what is MPH? Okay, MPH is Masters in Public Health program. It's a master's course. Next question is, sir, BDS graduate with 3-year experience doesn't require GRE and TOEFL. Yeah, I think students with medical qualification and relevant experience are exempt from GRE and TOEFL.
So you can be eligible for this. So try it
Yeah,
out.
so
We will try
yeah,
to help you.
yeah, so you can try and visit our website to proceed or see what are the formats that you have to fill. We can help you assess your eligibility for this program. Next question is, sir, I don't have research experience and publications. How can I improve my prospects to get selected for this course? You know, for this admission in this course, the research experience and publications are not a prerequisite, but if you have publications, research publications, that adds value to your CV, and therefore I think you should not be discouraged if you have minimum qualifications as prescribed and as Dr. S.D. Gupta has just shared with you. Please visit our website and initiate the process, and we will be very happy to assist you. I'll take, sir, the next question.
Yes.
If I adopt public health as a career, what could be future avenues? Mohan Gupta.
I think I have already showed it. What are the future revenues? So please look at the slides where I have shown what are the future revenues. Mangal sir, let me take the next question. Could you please give some insights why I should go for MPH program from IIHMR when it's available at substantially low cost in various places in the country? This is from Dr. Dhani Sharma. Okay, this is a very, very good question, very important question. Why you should choose Johnson Hopkins IIHMR program while there are courses available at 1 lakh or 2 lakh rupees all together in this country. So this you can know yourself. This program is ranked #1 in the world. You have to make a choice. What do you want? So a lot of MPH programs are offered in this country, and they have their own merits. Very important is they are very low cost. You want degree or you want your career, want to position yourself, the choice is with you. So world's #1 ranking program you want, what you want, this is up to you. You have to make it. We don't want to make any comment on the MPS programs being offered. I think there are 26 institutions and universities which are offering MPH, and they have their own designs and own rankings. So you can have a look, decide about, and depends on how do you see yourself in future, what is your vision for your career. You have to decide, you take a call. You have mentioned that the medical and MBDS student doesn't require GRE TOEFL, MBDS professional with 3 experience. Do I need GRE? Mr. Dr. Naren S. Naren, you should try, we'll try to help you. Sometimes they accept, sometimes they do not accept. So when it comes to put my weight and our weight on your candidature, we will do so. So submit your application. We'll see in future what happens. So yes, physiotherapy. I'm working as physiotherapist since 1 year, and I have a part-time job in private hospital. So my father is a master study. Which kind of course are available at IIHMR? जरा नीचे करो इसको. नीचे करो हितेंद्र.
Yeah, this is better.
Study which kind of courses are available in IIHMR or I am eligible for it. You know, IIHMR University has various programs, graduate programs and doctoral programs. IIHMR University offers MBA in health management, MBA hospital management, MBA pharmaceutical management, MBA rural management. It offers MPH, which we are discussing, then a PhD, and soon we are going to start with Doctor of Public Health. There may be new courses that may be initiated during this year. So this is what we have to offer at this point of time. So next question is,
On the yes, sir.
you are eligible, Jamini Patel. You are eligible. You should apply. You should look at the screen and submit the screen questionnaire. We'll check your eligibility. Next question is, hello sir, I have done MBA in healthcare management, so am I eligible for Doctor of Public Health? Then definitely you are eligible for Doctor of Public Health, but we have yet not started. When we start, you can think of it.
But sir, he can apply for our PhD program.
Yes, sure.
So,
She is good.
yeah, Anubha, you are eligible, or you can check our website and you can apply to our PhD program, and that is Doctor of Philosophy in Health and health related areas. And as Sarah just mentioned, we are in the process of starting DRPH program in collaboration with John Hopkins University, and that stage maybe you can be in touch with us. So next program is which university provides it? Sir, which
IIHMR
degree?
University and Johns Hopkins University.
Yeah, the MBA, MPH, the degree is offered. It's a collaborative degree offered by John Hopkins and IIHMR. MPH program means I have mentioned that it is a master's in public health program. It's a 2-year full-time program, as Dr. Gupta has just explained. जितेंद्र, इसको स्क्रीन को थोड़ा शिफ्ट करो.
Move करो भाई.
Yeah. Do the public sector undertaking come up as an employer? Piyush Gupta.
As we said earlier, if they have need for, so that there are CSR programs in public health, public sector undertakings, and they also have their health programs. They have their own hospitals. So it depends on what is the profile of that undertaking, and if they will definitely come for or open positions for MPH graduates. Okay, I think that we have finished with the questions. I have two more things to say, then I will stop. One is that when you go for credentialing, once you go for credentialing, the credentialing agency asks for dollars. I don't remember, they used to ask for $300 or so. So this on to SOFAS, and then many of the students do not apply because they think if they are not admitted, that money will be lost. So you don't have to worry about if you apply to Johns Hopkins University and your application is considered by or sent by the WFS. This is the word creating services. Credentialing services. IIHMR University refunds those who are not successful. Refunds those who submit application and their application is rejected by Johns Hopkins University. We refund that money which you pay to credential. So that has to be kept in mind. So you don't lose any money if you are not selected. So your money will be refunded by IIHMR University. Important thing is we are already in April, so quickly look at the website and send your screen format questionnaire at IIHMR. Dr. Seema Mehta is the person who is coordinating it, and our admission department for MPH, they coordinate. So you can write at MPH IIHMR link which we showed just a few minutes back. All your questions will be answered. If you have any question or clarification you need. The course will start in October.
So this is all, friends. This is public health is a very important discipline. There is a lot of scope both in India and in other countries. And MPH program that is offered by IIHMR University in collaboration with Johns Hopkins is the best program in the world, as sir has already emphasized. So please, if you find it of interest, contact us. We will be very happy to assist you in your process of submitting your application. Thank you.
Dr. Pankaj Gupta, would you like to say something?
Yes, sir. Am I audible?
Yes.
Okay, I would like to just thank our both Dr. Gupta ji and also Dr. ji for very, very insightful presentation and guiding all the participants today. And in those particular questions, I'd like to add on one question where somebody asked that when so many other cheaper options are available, then why to go for MPH from Johns Hopkins? So I just want to share information that if you want to do a similar MPH program from the Johns Hopkins, you have to more than $110,000, and the same thing you are getting from us, only $22,000. So you have to see that what kind of impact you want to make, whether you want to be a global player, and what kind of vision you have for your own mind. And the particular ROI is very high because we have seen that our students have been taking jobs in many international organizations, including ISAF, WHO. So the sky is the limit. I just want to share this. And secondly, after doing the MBA, I know that there will be many people from clinical background who might also be thinking, why a career in academia in public health? We look at it, these two gentlemen who are here, Dr. S. Gupta and who are very senior professors. Dr. S. Gupta was also invited to be a member of the Prime Minister's Economic Advisory Council and really advised, what kind of financing the scheme has to be there, what kind of HR issues has to be handled. And secondly, you are engaged in a lot of research work, and your impact is spread all over the world. So it is a whole new world of different possibilities. So I wish you all the best for your future success, and we are available to give you any other support. And Manu Agarwal is the person in the admission department, Dr. Seema Mehta, who is the chairperson of MPH program, and we all are available for that. I think we have got one more question, sir. Mangal, can you address that also as we are about to complete our webinar?
This question is, I am MBBS passed from Gogard State Medical University, Russia, but still I haven't MCI registration due to some of the personal reasons. But I have 7 years of experience of work in public health under NHM at Madhya Pradesh. May I get admission in your IIHMR Jaipur for doing MPH course without MCI? MPH is a non-clinical course. Syed, see, the MBBS degree is only awarded and or valid in India once you have cleared the MCI requirements. So I think until you have that, your MBBS degree is not valid in India. In this situation, I'm afraid that you may not be eligible for this course.
Although there have been cases where a student from who got MBBS degree from Russia, they have done program with us, but I'm not sure about this particular university. But you can still reach out to Manu Agarwal and we can discuss how this can be.
Yeah. So you can write an email to us. We can further examine this case and get back to you. So I think, sir, we have responded to the questions of participants of this webinar. So I think this is time to
Hello,
close.
sir. Sir, I had some questions.
Yeah.
Sir, I had some questions to Sir Dr. Pankaj, sir. Sir, could you please tell the current scenario? Like hospital sector is going through a very bad crisis. Like I had been reading of a hospital, the EBITDA has been very less, and today's newspaper told about hospital sector in heavy losses due to less footfalls. Can you please tell the scenario of what will be the future like after completing MBA from this course? What will the future like? How will be the industry be changed according to this corona outbreak?
Who are you? Can you please give your introduction?
Sir, I'm Dr. Raj, sir. I'm Dr. Raj. I'm a dentist.
So are you able to ask question by talking like this? Nice.
Sir, I had actually written, but it's not been came up actually.
Okay. You know that there is one, industry, public health and hospital, where there will be no recession. These days, it is a very extraordinary time. So you cannot really compare this moment with any other thing. But anyone who is doing their job well and who are managing their operations well, I think there is very less possibility that they will be closing down or something like that. And I'll also request our Dr. S.D. Gupta ji to share some thought on this, if he would like to.
सर आप म्यूट हैं शायद, तो मे बी अनम्यूट कर लें.
I think this is a global scenario, what question has been asked. But I'll go by what Dr. Pankaj Gupta is saying. The health sector is such that it never goes into recession. Education may go into recession, but health sector doesn't go in the recession. So one should be hopeful. It's a situation at this point of time because of this coronavirus and lockdown. So it is stand still. And then the hospitals today are also not entertaining patients. The footfall has gone down for one important reason, that they don't want to take a patient because he may be suspected to have coronavirus. And you might be knowing around 70% of the coronavirus patients or COVID patients are asymptomatic. So you never know when you hit it. And so that is the reason. So you should not worry about what is future. The economy of India will bounce back soon after, and it's believed that, but this health sector, hospitals, they will be back into action once this pandemic is over.
Is it okay, Mr. Raj?
Sir, I have received a question on my
Yes,
phone,
sir. Thank you, sir.
and question relates to whether there is any age limit prescribed for applying for MPH program. So I'm not aware whether there is any upper age limit for applying for this course.
I think it's not to my knowledge, but SD sir, what is your view?
There is no age restriction.
Yeah.
No age restriction. And if you have
Anybody
energy,
can apply for this course
if you
at
have
any
energy to go through the rigors of 20 hours of working a day for at least 5 days and 6 days, oh, you are very well, you can apply if you want. There is no age limit in this.
Okay, sir. Thank you. So, sir, shall we close this meeting now? Because we have.
Yeah, I think we should.
Sure, sir, sure. So thank you so much, SD sir, Mangal sir, for your very valuable insights. And I'm sure the participant must have got a great experience. And so really thanks a lot. Thank you, sir.